Welcome to the Perinatal Wellbeing Podcast. I'm Christine, your host and certified perinatal mental health professional. This podcast is all about authentic conversations. We want to open up the discussions around perinatal health and well-being, from mood and anxiety disorders to breastfeeding to grief and loss in the perinatal period, and everything in between. While this is not therapy or medical advice, it is the place where we are going to continue to open up the discussion around all things perinatal mental, physical, emotional, and sexual health to help reduce stigma and break down these barriers to support. I acknowledge that many Indigenous nations have long-standing relationships, both historic and modern, with the territories upon which Perinatal Wellbeing Ontario is located. Today, this area is home to many Indigenous peoples from across Turtle Island. I am proud to acknowledge that there are 46 treaties and other agreements that cover the territory now called Ontario. I acknowledge that I am a settler on these lands, and it is on these ancestral and treaty lands that I live, learn, and work. Hello, and welcome to Perinatal Wellbeing episode number 12. Today, I'm talking with Lisette and Catherine from Together Waterloo. Together came out of a desire to increase the services available to families struggling with perinatal mental health in Waterloo Region. Their goal is to increase support systems, educate healthcare providers, and build a village so that no parent is left behind. In part one of this episode, Catherine and Lisette share their experiences in the perinatal period and the mental health challenges they faced. Lisette Weber is a postpartum doula, the social media manager for PSI, and co-founder at Together Waterloo, along with Catherine Mellinger, an expressive arts therapist. They are both trained in perinatal mental health and are making things happen in this space. Please note, in this episode, we do discuss intrusive thoughts, birth trauma, postpartum depression, anxiety, OCD, intrusive thoughts and compulsions around sleep and food, challenges with nursing, trauma, fear, NICU experiences, and there is some swearing. Hi, Lisette and Catherine. Thank you guys so much for coming on the podcast.
Thank you for having us.
I'm so excited to have you guys on the podcast because you guys are doing amazing work in Waterloo, Ontario, trying to raise awareness for perinatal mental health, perinatal mood and anxiety disorders. And so you guys are perinatal mental health activists who are really trying to make a difference in your community.
Mm-hmm. That's the hope.
Yes,
That's
absolutely.
the goal here.
Absolutely. So would you guys like to tell us a bit about both of your stories and how you kind of came to where you are today?
Sure. So I came to this work through firsthand experience, as a lot of us do.
Absolutely.
I've got two kiddos. I've got an almost 9-year-old and a 4-year-old. And I came into this from the perspective of pre-existing mental health struggles. So I've lived all of my life with obsessive compulsive disorder. I was diagnosed in childhood. And before I got pregnant with my oldest, I had been managing through therapy and, lifestyle, what would you call it? Lifestyle sort of curation to handle my OCD. And then I got pregnant. And looking back on it now, I think I didn't notice how much my symptoms were increasing during my pregnancy because I had a little bit of like a whirlwind experience of like getting married and getting pregnant very soon after. And I was still coming down from like getting married, this kind of idea of like a honeymoon. And then I found out I was pregnant right at the end of my honeymoon. And then we went right into pregnancy. And so I just was nauseous for 3 months. And then and because I was working and I was like, I just wasn't coming down from anything in my pregnancy, but I kept sort of saying it was just because I was pregnant or like because I had all these things going on and I couldn't really recognize that my anxiety was really starting to ramp up already. And I think I also assumed that it was anticipation, that it was like the anticipation of having a baby, the anticipation of the labor was what had me sort of activated, because I was trying to work and be pregnant. And, I think I was also working on like a book cover for somebody, and I was still doing my art on the side. And so I think I thought it was just anticipation and sort of preparatory stress. And I assumed that would just go away. Like once I had the baby and once I could be completely in love and not leave the house and have a baby moon and like all this stuff. And I had no idea. I had no idea what the risks to my mental health were in the postpartum period. So after I had my oldest, who's now almost 9, I crashed really, really, really badly. And, I don't know that I've experienced that level of sort of symptomology, like in terms of that level of symptomatic experience and combination of high anxiety and OCD. I don't think I'd experienced that since I was 12, at like the height of understanding that was part of my experience. And it wasn't very long until a really good friend of mine, who was also stepping in as a postpartum doula, said, you don't seem okay. Like you just don't seem okay. And I just kind of lost it. And, then began the sort of journey of being recommended to the Reproductive Life Stages program in Toronto, having an amazing experience with Dr. B. God there, like just a complete perspective shift, because I'd been managing so effectively for so long. And, there's ups and downs in the efficacy of management with having OCD or any sort of mental health issues. But I had been managing for so long that I didn't have a plan, a protocol. I had no idea what to do because I hadn't been a kid since I'd felt that bad. So I just had no preparation for it. I was just completely floored. I was, it was like the rug was pulled out for me. I had no idea. I was like, and at the worst of it, I just was questioning. I mean, I always tell people, like, at the worst of it for me, I was up at 2 a.m, like middle of the night, with boobs that are like hard as rocks and leaking all over the place. And I started making a list in my head of all the people that I could ask to take my son, because I just was like, I'm not supposed to be doing this. I'm not supposed to be doing this. I don't know how I didn't know how to get to the next day. And that was probably the worst of it. Like when I'm literally on the verge of calling my sister and asking her to take my baby, and just being completely in shock that thought process seemed completely natural to me. Like that seemed like a rational thought process when I was in those moments. And it wasn't until afterwards that I realized, like, that is intense. Like when I really realized how bad it had gotten for me, that I sort of had to deal with then the shock of actually having thought those thoughts and felt those things and all of that. So, fast forward another 4 years and I got pregnant with my second. And part of the reason why I have 4 years between my kids is because I needed time. I needed time to process my experience. My partner and I needed time to process that experience. We needed therapy to talk about what that was like for us and how to do it again, and do it again while being terrified of doing it again, but knowing that we wanted more than one child. And that process was very different. I had a doula for both my births, but with my doula for my second, like part of the active role as a doula was to talk to me about my mental health and to ask me what my plans were and to actively be transparent, to actively go down the route of the worst case possible, because we had gone down that route before, and to not be afraid of talking about the things that I was really terrified of. and the things that, some people might not decide to have any others if you've had that experience. And I just was like, okay, the only way I'm going to be able to do this again is if I start talking about this stuff, and if I start planning for it, and if I start like making sure that I have all my ducks in a line so that I can lose it again if that happens, but that I will be okay because I will know who to call and I will know where to go and I will know what I need. So I never had the feeling like I'm going to fix this and this is going to be the perfect experience this time, because I knew that was impossible, especially because like for me, it was different. I had a pre-existing condition. I'm not getting rid of my obsessive compulsive disorder. I never will. And so like, how do I continue to manage it with these upswings and the downswings and all of these transitions when it's going to set on fire again? So that was a part of my second experience. And it was a very different experience, but emotionally it was not nearly as dark as it had gotten, but the same thoughts came again. It was the same, it was very similar narratives. It was very similar anxiety. I just had more space for it and I wasn't shocked by it. And the processing could happen more in the moment rather than it being like 6 months later, this full realization of what was going on. So yeah. And so that really, after my first, I started being very interested in perinatal mental health and how I could use expressive arts therapy and my sort of skills that way to work with that. And so after my second, it just ignited that much more for me of just wanting to do more, wanting to learn more and wanting to stand up more and wanting to like yell from the rooftops, like, help, like people need help. Like this is a thing. Like we can't just, I wanted to be loud. I wanted to be loud and I wanted to be an activist. And I just didn't want other people to feel the rug pulled out from under them like I had, which is sort of where I am now.
Yes.
And then, I met Lisette, and she'll tell you this as well. I met Lisette in the prenatal group that I was in when I was pregnant for my second. And I don't remember Lisette, but I think I was very vocal about how much I struggled after my first, like in the prenatal group. And it wasn't to like scare people, but it was because it wasn't something that was being brought up unless I brought it up. And I think I also just purposely wanted people to know that I'd had a really shit time after my first, so that like, if they had a shit time, that they'd be like, oh, but I remember somebody in my prenatal group saying that they also had a really hard time. So I just wanted it to be out there. Like I wanted people to know, like, if you are feeling crappy, like I am the person who will vouch for you and who will like help you, because I didn't have that. I did all the prenatal classes with my first. It wasn't mentioned. And I had a diagnosis. It was like it was written down on all my paperwork. Like it said right on my intake forms, diagnosis of OCD in childhood. Like the only question I was asked was, how are you managing? But there wasn't any like, I lied. I bald-faced lied because I was like, yeah, I'm fine.
Yeah.
Like I think, but I wasn't.
Right. And why do you feel like you lied?
Because it's shameful. I mean, you don't want to admit that you're struggling. I mean, I will also say this, my baseline for anxiety, and this is something I've learned through, 30 plus years of therapy at this point, like 42, I was diagnosed at 10. My baseline for anxiety is very different than somebody, it's like people who have different pain thresholds. Like somebody with fibromyalgia actually has a higher pain threshold, but the level of pain they're experiencing is that much more escalated than like the average person. And so it's like it just keeps ramping up. And that's my experience with anxiety. Like I do actually thrive with like a really optimal level of anxiety because that's how my brain runs. And so I think because my baseline is higher, it tends to go extreme very quickly. But also it's difficult to it's difficult to tell where those lines are of just like, oh, actually, this isn't great. And also, I think it requires people to know you personally. It requires people to know you personally and to have a relationship with you where you can say something that you're thinking, and that other person can say, I haven't heard you say something like that in a really long time. And I didn't have, like, looking back on it now, I was also diagnosed in the early 90s. So there's a very different experience of mental health when you're diagnosed as a child in like the 80s and 90s. I was told, take this medication and it goes away. I was never sort of given this. It's only in the last 10 years that I've realized it doesn't go away. Like, that's just not an honest experience of something like OCD or like a lot of mental health conditions. And so I just assumed it wasn't a part of my story anymore. But the more I think about it now, it's like the amount of intrusive thoughts I was having when I was pregnant, the amount of checking on my husband I was doing, the amount of like, even just sorting baby clothes, like how anxious I was getting about food, how rigid I was getting. Like, there was a lot more superstitions that were swirling in my head, but I also didn't have anybody to talk to about them because I had set up this system around me where everybody just thought I was okay. And so even my partner, this is a little bit more information, but like my partner and I are, we're temporarily separated and in some pretty intensive marriage counseling because we're realizing, like, almost 10 years into being married and having children, there is so much of my mental health experience that he doesn't know about, and vice versa, because we didn't have space to talk about that. So I think it also just takes somebody that you can be brutally honest with. But the thing with OCD, and I think with anxiety and intrusive thoughts, like, it's really, really scary to talk to people about the things that you're seeing in your head.
Right.
There's a lot of stigma around that. There's some really, really awful things that go through my mind sometimes. And if I didn't know what they were, I would think that something was massively wrong with me. So intrusive thought dialogues aren't necessarily something you usually share with people because it's scary. For other people, this is the thing, like, they can be scary for me, but the amount of stuff that I brush off now because I've lived with this for so long is kind of crazy, and pretty intense. And if I was to actually vocalize it to somebody else, I don't know what their response is going to be. I don't know what that's going to look like. And I can't necessarily trust people to understand it. And I think that's just part of the stigma and the shame that's around, OCD in particular, but then mental health struggles in general.
Yes. And then do you feel like because there aren't enough spaces where we openly talk about intrusive thoughts, OCD, other mental health issues, it sounds like your healthcare practitioners were not asking you, specifically. It sounds like there wasn't education there around what could OCD look like in the perinatal period.
Mm-hmm.
So did that contribute to not feeling like I can talk about this and open up this discussion?
Mm-hmm. And I think with OCD in particular, and I think for other conditions too, like, sometimes you're just doing things and you're not aware. Like, if you don't have the ability to have an observer or to observe yourself, nothing seems strange about it,
Right.
And so, like, and this was the thing that was really tricky because a lot of, like, I have quite a bit of OCD that's centered around food, or has been previously. There was a lot of my OCD that was supported by pregnancy. So to get very specific about food, to get very rigid around food, to have like contamination fears around food, well, nobody's going to fight you on that because there are so many things that you can't eat when you're pregnant. People want you to pay attention to what you're eating. People want you not to eat certain things. People do make you scared about contamination issues with food when you're pregnant. And so that part was like so supported by my pregnancy experience, and also like supported by the people around me. That was just like, well, she's pregnant and, like, there probably are things she shouldn't eat. And like, that was just something that was sort of supported by the pregnancy experience. And that in retrospect was what was really difficult to tease apart, because yeah, like I was terrified of bacteria on my food all the time. It wasn't just about the bologna. It wasn't just about the raw shrimp on my, like, it wasn't just about the sushi. It was like, it's like, oh yeah, like I thought everything was contaminated, not just these foods that I was told to stay away from. But that's like a really specific thing to have to tease out. And there's a number of things that just get naturally sort of lumped into this, like, oh, well, you're pregnant, like your hormones are raging, all these things. But the thing is, like, yes, your hormones are raging, and that can have a direct effect on your mental health. And so there was a lot of, I don't want to say dismissing, because it's so hard, because people aren't doing it on purpose. It's a lack of knowledge. It's a lack of knowledge. It's a lack of awareness. It's a lack of experience. But it got missed. A lot got missed.
Right.
And a lot of it got chalked up to like, well, she's pregnant.
Right.
It's like, yeah, I'm pregnant and I have OCD. Like,
right. Yeah. And how do those intersect? What do I need to prepare for?
They intersect a lot. I mean, think about how many medical things you have to go to. That's triggering for anybody with OCD.
Right. Right.
You know, and it's triggering for somebody who doesn't have OCD. Like you have constant reasons why you should be concerned, because you have this ultrasound, you have this blood work, you have this, you have to see your baby, you have to make sure they're okay. Like you have so many things that are creating worry for you in your pregnancy, that it just becomes a cascade.
Absolutely. And I'm curious to know, you don't have to answer, but is the prescribing doctor for medication the same as who followed you, like a family doctor? You know,
yeah, so I didn't, so at the time I wasn't on any medication at all.
Okay.
I had only taken a really short course of pharmaceutical treatment when I was a child, because I was diagnosed at 10. This also has to do with hormones. I hadn't hit puberty yet.
Yep.
So they did like an intensive course of treatment for 2 years. And then it was like, cross your fingers, fingers that it doesn't get worse in puberty. But that was something that was always mentioned, was that, you know, like just watch her when she hits puberty, because the hormonal fluctuations can affect that. So I had been I had been off of medication since before getting my period. And so I was followed by a family doctor, but I didn't have a psychiatrist that I was working with, because it was sort of, it was considered, I think they would now call it symptom remission. Like, but that's also, I mean, that's also tricky, because symptom remission, like my externalized symptoms were in remission. Like I wasn't stuck in a compulsion and ritual cycle. Yeah, I wasn't stuck in the outward cycles, and I was functional, quote unquote. I was doing well externally, but internally was a very different story, but nobody can observe that but yourself. And so for me, it just wasn't anything different.
This is just how I am.
Yeah. So at the time I was just followed by a family doctor, and I wasn't on medication until after I had my first. And then when I went to the reproductive life stages program and I met Dr. Vigod, it was like somebody whacked me over the head with a cast iron pan. I was like, how did you nail it? Right. In an hour of meeting you, you know, because I'm coming here like specifically because I'm struggling after I had a baby, and you're just looking and you're just hearing my entire narrative and can immediately see that this is just a lack of follow-up for the last 20 years. And also like no judgment on that, like just a complete awareness of how that happens to so many people. And I didn't know about the reproductive life stages program. I mean, it turns out I would have been eligible even before I got pregnant. It turns out I would have been eligible when I was just thinking of having babies, but I didn't know that. And so there's a lot that I learned in a very intense amount of time after having my first.
And this is what I am wanting to advocate for, is the screening, right? And these discussions where, you know, for example, if you go to your family doctor and say, hey, I did a pregnancy test, I'm pregnant, like, what do we do now? Your mental health, especially that you had a diagnosis on paper,
Mhm.
I feel like that has to be screened. It has to be asked about
Yeah.
and given resources, right? Like a family doctor is not a psychiatrist, and
No.
that's okay. But at least if we ask the questions and we have the space where you're like, maybe I can tell this person that
Mhm.
I have a lot of intrusive thoughts or I'm not feeling great,
And it takes
or
the right person to ask the right questions, because I could have
absolutely.
gone to see my family doctor and they could have asked me questions about being sad, and they could
Yeah.
have asked me questions about different things. But I mean, it does take somebody to really understand what the OCD process can look like, to be able to ask the right questions, and also to be able to make somebody feel safe to actually say what intrusive thoughts they might be experiencing, and to understand like the variety and the diversity by which intrusive thoughts come.
Yeah.
Um, so yeah, I think it takes also being able to ask those questions in the right way, or to be able to refer, but not make it like, oh, you seem like, just so you know, you're going to really struggle, so I'm going to send you to somebody just in case, like that it becomes a conversation about prevention.
Yeah.
And also just, oh, I see this in your file, like, why don't we schedule something with a psychologist or a psychiatrist, like just so that we can talk about how pregnancy might affect your mental health with a pre-existing condition. And then for that person to be able to specifically talk to me about things that they know to be present in OCD, or to even ask me what my OCD was like as a kid, so that they could mark those things and then come back to me after birth and say, is this a part of, like, has this become a part of your experience again? Because everyone with OCD has really, like, we don't all have the same triggers or anxieties or compulsions, like they're very diverse. So it also takes somebody knowing like, oh, was part of your experience previously. So I'm curious if those have been coming up again, like whether that's specific to contamination, whether that's specific to checking, like I was waking up every hour and putting my finger under my baby's nose. And checking was a huge part of my OCD experience as a kid. Checking locks, checking ovens, checking always. And so for somebody to know that and then say, how are you finding baby's sleep? Are you checking on baby when they're sleeping? Are you finding yourself checking if they're breathing? Because I was.
Yep.
Like 5 times a night, I was either putting my finger under my oldest's nose, or I was putting my hand on their chest and making sure it was going up and down. I wasn't sleeping and it wasn't because I was nursing, because that first thing everybody's going to say is like, well, can you let your partner give them a bottle in the middle of the night? It's like, no, I'm not waking up to feed them. I'm waking up to make sure they're breathing.
Breathing. Yeah. Yes. And I think that, absolutely, I totally agree with you that if we can open the discussion and then have those referrals, right? Like, hey, this is someone you can talk to learn about
Mhm.
the intersections of your mental health that, your mental illness that has already been diagnosed
Mhm.
and pregnancy. This is what it can look like,
Yeah.
Just to talk about it, right? And then get you into that place with the expert,
Yeah.
so to speak, in that field, and hopefully build that safe place.
Yeah.
Again, I think the important piece is to be connected,
Mhm.
which is not happening,
Mhm.
right?
And I do
For
think
people.
there's certain things that do get picked up on. Like I did actually have a friend who was pregnant at the same time as me. This was in Toronto. And I didn't find out until we both had our babies in the world that she also went to the reproductive life stages program. And she went from the moment she tested as being pregnant,
Wow.
because she had a history of PTSD, and she had had some really traumatizing experiences, and she was on her own. She wasn't with a partner. And so those were flagged. And so she was given access to those services as like a preventative measure, in terms of like, you're going to be doing this on your own. We know that you have some abandonment trauma, like, let's get you some tools. And so she did actually get to participate in a lot of programs prior to having her baby, and then was like preparing herself to have a really hard time after the birth, and then just ended up okay, and so
Right.
you never know. And so I think it's that kind of, it feels almost like a gamble. Like you have to have the right things
Yes.
that become a marker of like whether you're flagged or not, but that was just really interesting to hear from her after we had our babies, and just being like, damn, I wish somebody had caught that for me, because that sounds amazing. Like,
Absolutely.
yeah.
Yeah. And I think that's where, hopefully one day soon, a national perinatal mental health strategy could help, right?
Yeah.
In that we are screening, we are asking people, right? It's even I say, like, if my doctor just asked me, like, how are you? Right. Or like commented on the fact that I was bawling my eyes out every appointment, right? Like
Yeah.
that might have been helpful, right? And so even just like automatically giving these resources as part of your care plan for anybody, diagnosis or not. And I think especially if there's a pre-existing diagnosis, then absolutely, what do you need in your care plan for your mental health?
Yeah.
Right.
And I think that it's presented as something that isn't scary, because the experience is scary. Like, not gonna lie, it yourself. It is really scary. However, it can be made to feel less scary if you understand the commonality of it, if you understand the science behind it, if you understand the psychology behind it. Like it can, I don't want to say normalize, because like, we want to decrease the rate that people are experiencing this. And there's a very complex amount of things that cause this, that are putting us in the place where we are right now as a society. However, there is something to just telling people that they're not the only person, like that they're not the only crazy one, that yes, this is happening to you. And I completely, like, this must feel so scary. And also here's step 1 through 15 of everything that we're going to do to just make you feel less alone in being scared. Yeah, I think that, because the way that it's portrayed from a societal perspective is like this thing nobody ever wants to have happen. Like there's so much, because yes, it is scary, but also that we shouldn't be so fearful that we can't actually see what's happening, because we're just so afraid to admit that we're struggling, because if we do, then that means we're all these horrible negative things that everybody talks, like we're unfit mothers, we're incapable, our children are going to be a mess, like all of these negative things that show up that basically just make you feel like you're nothing, like you're no longer of value to the world around you, because you've just fallen into this, you've fallen into becoming like a scapegoat, like a societal scapegoat of, this is why so many people should get screened before they have babies, make sure they're fit, like all this, like, I mean, it goes as far as like some eugenics bullshit, like,
right.
And it's connected to a lot in our society. And so, yeah, like it is just real. It's almost more scary to admit you're having a problem than it is to actually just be able to name what's your experiences and experience the scariness of having that experience. Like I find the societal repercussions and the societal stigmas around struggling with mental health, and particularly with perinatal mental health, I find that to be scarier than the actual day-to-day experience.
And that's, the hope here, right? Of like having, people share their stories and talking about these things of like, these things exist, these things happen, let's talk about them more. And if you are experiencing them, knowing you're not alone, and also that there is help out there. Like, let's try to help people get these resources, right? Like you said, not knowing that existed. I didn't know either. I actually went to the same program because I lived in Toronto at the time.
Oh yeah. Yeah.
Yeah. So it was like, I had no idea until
I had no idea.
Yeah.
And honestly, like as a person who has their period and like presents female and live, like somebody with a uterus who wants to have a baby, like, shouldn't we know that the program exists, like, prior to trying to get pregnant? I mean,
exactly. Right. And having these discussions, and imagine knowing beforehand, like how OCD can show up, for example, in the postpartum period or even in pregnancy,
in
right?
pregnancy in particular, I think was the
You
one that
know,
was the most, wouldn't say the most surprising, but also what really struck me was how much of it was so acceptable. Like, a lot of my behavior, which was actually quite troublesome, was seen as really acceptable during pregnancy. Being anxious, thinking something's going to happen to the baby, being worried about eating the wrong thing, like, all of those things were actually very accepted behaviors. But the intensity at which I was experiencing them was not okay. It was not okay. Like, I didn't want to sleep in certain positions because I was terrified that I was going to, like, suffocate the baby inside my uterus. Like, I mean, it can go too far, but if nobody's actually looking at the scale of an experience or the scale of a thought, then it's very easy for those things to be considered like just a normal part of the pregnancy process.
Right. And wouldn't it be amazing if every birthing person who wanted to could have access to a perinatal mental health therapist, even as like, you know, a check-in or having a session and just like checking in, like, how are you feeling about being pregnant, right? Any existing mental health issues, or, you know, what's going on for you right now? And would you like continued support, you know, or this is how you can come in contact with me if, let's say, down the line, you're struggling with your mental health, right? Just having, you know, the support existing and getting the word out there that these supports exist. I think is so crucial and part of the work you guys are doing and, you know, I'm trying to do. And, you know, because it's just not okay, you know, the way we're treated and not taken care of. Right. Absolutely.
Well, and then Lisette and I had such different experiences, but also such similar experiences too, that was really interesting. I mean, we've talked so much, you haven't even told us your story yet, Lisette, but we've often talked about that, like how they were very different and also very similar, because we've admitted, like, we're not, you and I are, I don't know, Lisette and I have said this before, we're not people that folks would like put together as like as friends or like as people who become, you know, like besties almost in a way. But our experiences were so different and also so similar at the same time.
Well, Lisette, do you want to share with us your experience?
Your turn.
No, it's always so interesting because I've heard Catherine's story a number of times, and it's every time you always go a different direction. How far back you go, how like what like theme you're trying to like tease out and all that. So it's just, I get like enthralled. I'm just like listening. So I came to pregnancy with no pre-existing conditions that I knew about in comparison to Catherine. Like I, you know, always was great with kids growing up, wanted to get married, have babies. Like it was just kind of the life plan, right? And so it was interesting when it didn't really go as I had thought planned. Like both my kids were December babies, which is just, don't have a December baby is all I can say about that. It's intense. So my daughter was an induction that kind of left me traumatized. Like it just, I didn't know what was happening and nobody was stopping and to talk to me at all. It was just kind of like, oh, we're going to do this now. And we're going to do this now. And we're going to do this now. And I'm at like the first, oh, we're going to do this now. I was like, where is this all going? So my daughter was an induction and at like 42 weeks. And she was born 5 days before Christmas. So needing supports was kind of impossible because, oh, let's get a tongue tie release. And like, it felt like the midwives had to find like some back alley doctor who was still open that could, perform that in order to get us help and support. And so it was a lot of feeling like we were abandoned, even in hospital, because we were transfer of care from midwife to an OB. Suddenly, like, the nurses didn't offer me a new gown after I gave birth because I was a midwifery client. Like, they didn't need to do that. And so, like, it was just all these little subtle things that you don't realize, like, just add up so much to like just being completely like traumatized. And how we were, surrounded by people to help, but like I didn't realize what the help was I needed. Like, things just weren't going right in my head. We were struggling to breastfeed a lot, and that is really where I noticed like the spiral for myself. Just kind of becoming obsessed with it, but also wanting to like completely disengage from it. It was just a lot of like thinking I'm supposed to be amazing at this, thinking I'm supposed to be like a great mom who's like breastfeeding her baby, and everybody's going to be like, yay, you're like the best mom ever. And like realizing that like it was hard, and like nobody was like telling me I was doing a good job. Like, right when I'm just like, does this look right? Like, I don't know what I'm doing. And they're just like, sure, like it looks great. It's like, but this isn't working.
Right.
Like,
Yep.
I'm in pain.
Yeah.
And like just having like that's when a lot of intrusive thoughts started, because like I'd be struggling and like I would just suddenly have like intrusive thoughts of, suffocating my baby, or like nap time was also like the worst time of life. Trying to get her to sleep because she was like she cried a lot, she she wasn't entirely a pleasant newborn. She's still pretty loud now at 4 years old.
She was high intensity for sure. She was a very high intensity baby. Like, crying was long bouts of crying, not just a little bit of crying. Like, sleep was really difficult.
We had witching hour. So like it was, we would spend several hours with an inconsolable baby who wasn't breastfeeding well, who I was pumping around the clock, like doing this stupid cycle of like attempting to breastfeed, then pumping, and then using that pump milk to then feed the screaming baby. It was just a lot. And like, I just wish somebody had told me that like, if it wasn't working, we could do something else. And that would have been like the most helpful thing to have heard at that time. This midwifery clinic that I was with, Catherine was also with them, and they have what they call a connecting pregnancy group. So of course, like I already had in the back of my mind this like, other person in the group who never stopped talking about like her experience with her first, So it was always like, it was back there. So when I always like say this, like my rock bottom, where I realized that like I wasn't just sleep deprived, that there was something more happening, was it's just like I was at home with a screaming baby who I was trying to like keep a soother in her mouth while she's in a car seat. I'm laying on the floor, like in hysterics, attempting with the other hand to text my husband to come home from work. And I'm just like, this isn't right. This isn't how it's supposed to go. So that's when I really reached out for support, because I was just like, this is dark. This is officially gotten too dark, and I need help. And so like this connecting pregnancy group became like a baby group afterwards, and we like started meeting up, and like through conversations with Catherine, it was just like, oh, maybe I have postpartum depression. Maybe there's some postpartum anxiety in there. And reached out to a family doctor, got support. But what I realized, and what Catherine like kind of confirmed for me, was that Waterloo Region doesn't really have supports. There is a support group run out of an earlier center, but you had to go to it. You had to commit to 6 weeks going to it. And me in my head, if I leave my house, she's going to cry because I'm incompetent. People are going to think I'm incompetent and somebody's going to take her away. Like there was no way I was going to leave my house to go to this support group. It wasn't going to happen. And so this is kind of like where we realize that like there needs to be more options. There needs to be, not every support group is for every person. So like there needed to just be more. But at that point, we didn't really know. We had no plans. We
had no plan. We just had attitude.
We just had a lot of attitude. Yeah.
Yes, which is helpful. I thoroughly enjoyed talking with Lisette and Catherine about their personal experiences in the perinatal period, as well as their experiences with mental illness. I'm grateful to them for sharing their honest and authentic stories. You might have noticed that I asked Catherine if her prescribing doctor was the same as her family doctor or was helping to coordinate her care. I made the false assumption that Catherine was prescribed medication for her OCD prior to pregnancy, and I acknowledged this with Catherine afterwards. It's just a reminder that we can really never assume anything about anyone's experiences with mental illness. On next week's episode, we are going to hear how Lisette and Catherine started Together Waterloo and became agents of change in their community. It's really inspiring, so make sure you tune in. You will really be able to hear the passion and excitement in their voices, and just know that any of us can become agents of change, and any of us can make really big impacts on our communities and help the people around us. If you want to donate to Together Waterloo through The Climb, please go to their website at togetherwaterloo.ca. All of these links are in the show notes, so make sure you check them out. Leave a comment about your thoughts on today's episode and make sure you connect with all of us on Instagram. Thank you so much for listening to this episode. Please share this podcast with any of your friends or family members who may benefit from it. If you feel you are experiencing any of the symptoms or issues that we discussed today, please reach out to any one of your supports. You can also go to perinatalwellbeing.ca for more information, blog posts, and podcast episodes. Check out our new episode every Wednesday.